Hello and welcome to this video on Introduction to Statistics in Critical Appraisal Part 2. In these short tutorials, we're going to look at common statistics which appear in research papers and how to interpret them to aid you in critical appraisal. In Part 2, we will focus on confidence intervals and p-values. See our Part 1 video for information on odds and risk ratios. Let's start by looking at confidence intervals, what they are and how to interpret them. The confidence interval, as defined by CASP UK, is a range within which the true size of effect, never known exactly, will lie, with a given degree of assurance. It is a range of values which tells us how precise the results are and therefore help us to determine how statistically significant those results are. They are often reported at the 95% level, which means if the study was repeated, 95% of the time the results would fall within the quoted confidence interval given. When you see a confidence interval within a paper, it will display the upper and lower limits, which shows us the smallest and greatest effects of the intervention, with the true value included within that range. Ideally, a confidence interval should be short and narrow, with little variation between the smallest and greatest values. This is because this indicates that all the patients within the research experience similar results. However, if you see a long and wide confidence interval, this indicates that patients in the study experience significantly different outcomes, making it more difficult to predict how patients would react to the intervention. Let's take a look at an example of a confidence interval. Our examples have been taken from the 2022 paper, Efficacy of Bladder Stimulation Techniques for Urine Collection from Infants, a Systematic Review and Meta-Analysis. The confidence intervals here relate to the rate of success for the newborns group and the infants groups. For the newborn group, the confidence interval is 72.9% to 89.1%, and for the older infants, it's 35.3% to 67.7%. We can see here that the newborns figure is narrower than the confidence interval for the older infants. How would you interpret these confidence intervals? Do you think they are narrow or too broad? You may want to pause the video here. It's important to note that your interpretation of a confidence interval will become easier the more practice you have at appraising, and it's always beneficial to appraise a paper with others. Bear in mind as well that confidence intervals are often reported at the 95% level, so there is a 5% chance that the true value is outside the range reported. Remember, these statistics are here to help you, but you always need to consider the paper as a whole before you apply any information to your patient group. Often with a confidence interval, you will also see a p-value. A p-value indicates how likely a result occurred due to chance and not because of the effectiveness of the intervention. So how do we interpret a p-value? Typically, a p-value of less than 0.05 is considered statistically significant, meaning chance is unlikely to have played a part. Anything which is more than 0.05 would tell us it is highly likely that chance was a factor. When the figure is exactly 0.05, there is a possibility that chance played a part. When you're looking at p-values, remember to check if the authors are using a different baseline p-value. In the slide here, we have three p-values which are related to outcomes taken from the 2022 paper, Effectiveness of Additional Resistance and Balance Training and Telephone Support Program in Exercise-Based Cardiac Rehabilitation on Quality of Life and Physical Activity, a randomized control trial. The p-values are 0.027, 0.011, and 0.019. How would you interpret these p-values? Pause the video here if needed. All three of these figures are less than 0.05, so we can be fairly confident that chance did not affect these results and they are statistically significant. Thank you for watching this video. Contact your site library for one-to-one or department support with critical appraisal, or you can view our YouTube or Moodle course available on the Trust Moodle page for 24/7 training.